My name is Wilkinson. I'm a pulmonologist in the Division of Advanced Lung Disease and Lung Transplant with the Inova Health System in Falls Church, Virginia. Today I'll be talking about pulmonary hypertension and supportive care, specifically on some of the pharmacologic and non-pharmacologic treatments your provider may prescribe outside of the typical pulmonary vasodilators. Objectives for today. I hope by the end of the video you understand the range of pharmacologic and non-pharmacologic treatment options in pulmonary hypertension. You know the role of diuretics in managing fluid retention and pH. You know the role of oxygen in pH and various forms of pH, and understand the role of exercise in pulmonary rehabilitation. Diuretics are a cornerstone of treatment. They remove fluid from the body by increasing urination. This draws out water as well as electrolytes, which may be monitored or supplemented. Diuretics are used in combination with salt restriction, sometimes called sodium restriction, to manage fluid retention. It's important that you monitor your weights closely, as increased fluid retention may be reflected in rapid rises in weight, in addition to symptoms or signs like swelling in your feet, ankles, legs, thighs, or abdomen, as well as the feeling of bloating or increased shortness of breath. Rapid weight gain often indicates excess fluid, and it's important to communicate this to your treatment team. This table outlines common diuretics that may be used in managing your fluid status. The most commonly encountered are furosemide and bumetanide, which are available both oral and IV, as well as torsemide, which is only available as an oral medication. These remove fluid from the body, but may also affect things like your kidney function and electrolytes, which your provider may need to check regularly. Other agents that can be used in conjunction with these diuretics include things like metolazone, which increases the effect of furosemide, bumetanide, and torsemide to allow for further fluid removal, and agents like spironolactone, eplerenone, and amiloride, which may have a role in helping to conserve electrolytes like potassium in the body and have some beneficial impact on heart remodeling. Oxygen therapy. So oxygen is commonly used in a variety of pulmonary conditions. Low oxygen increases constriction of blood vessels in the lungs. It may be seen with a variety of lung diseases like COPD or interstitial lung disease where pulmonary hypertension can occur. Increased constriction of blood vessels puts more strain on the heart, which can worsen signs and symptoms of pulmonary hypertension over time. And so appropriate oxygen levels during rest, exercise, and sleep are important to try to reduce strain on the heart over time. Your provider might test oxygen levels at rest, with walking, and overnight, or order studies specifically to exclude things like sleep apnea and other sleep-related breathing disorders that may occur in patients with or without pulmonary hypertension. And oxygen can be delivered portably to allow for more mobility and hopefully improved quality of life. This table summarizes some of the ways you might encounter oxygen or oxygen therapy could be delivered. Pulse oxygen is often used with portable concentrators, where the oxygen is delivered just during inspiration. This helps conserve battery life to allow for more mobility and time outside the home. Continuous oxygen is usually delivered through a stationary concentrator, which must be plugged into a constant power source. Oxygen tanks allow for higher levels of oxygen delivery than portable concentrators at the expense of some reduction in mobility, as they can be large or bulky. And in cases where sleep apnea and other sleep-related breathing disorders exist, treatment with CPAP, continuous positive airway pressure, or BiPAP, bilevel positive airway pressure, may be necessary. Oxygen can be delivered directly into these devices to help maintain normal oxygen levels during sleep. And if you find oxygen uncomfortable, drying, or experience nosebleeds, please discuss humidification of your oxygen with your provider, as this is more comfortable and is easily adapted to stationary concentrators. Exercise and pulmonary rehab. Aerobic exercise is important for a healthy lifestyle with or without pulmonary hypertension. It is important to discuss what types of exercise are most appropriate for you, as things like heavy lifting can be dangerous or harmful in cases of pulmonary hypertension. Usually delivered over several sessions across multiple weeks, pulmonary rehab is commonly used in a variety of lung diseases and provides not just improvements in stamina and functional ability, but in general improves patient well-being and provides education and empowerment to patients with pulmonary hypertension. A word on other pharmacologic or medical therapies. Anticoagulants, often called blood thinners, may be used in some conditions where clotting has occurred or more common. Not all patients with pulmonary hypertension require treatment with blood thinners, but in those that do, it's important to monitor for signs or symptoms of bleeding and to discuss with your providers if you're on other medications that may increase your risk of bleeding, like aspirin or NSAIDs, things like ibuprofen or Aleve. Digoxin, commonly called digitalis, is a medication occasionally used in cases of abnormal heart rhythm and may be used in certain patients with pulmonary hypertension. When used, it's important to discuss with your provider, as monitoring of electrolytes and medication levels may be necessary. Thank you for your time. For more information, please visit phassociation.org.